Let's take a look at smoking and periodontal disease this week. It is time for Wednesdays with Wagle. Get some great information from Dr. Jason Wagle with Kansas Perio and Dental Implants. Good morning, Dr. Wagle.
Good morning, Chad.
Hey, so let's start out. What's the connection between smoking and gum disease?
Ted, the CDC reports that smokers have twice the risk of gum disease compared with non-smokers.
Although we tend to have fewer people smoking nowadays, though.
That's true, but it's all relative. You know that smoking was very common in past generations, but as of today, 34 million American adults still smoke. You don't notice it as much because smoking has been banned in most public places.
What about the number of cigarettes smoked per day? Does that make any difference?
Absolutely, Ted. There's a direct correlation between the number of cigarettes you smoke and the number of years you smoke, with a greater risk for gum disease.
So when that gets treated, how do smokers respond to that treatment for gum disease?
For smokers, it's much more difficult to get their gum disease under control than it is for non-smokers.
And why is that?
Smoking weakens your immune system, and once you have gum disease, smoking makes it harder for your gums to heal. Gum disease attacks the gums and the supporting bone and can lead to tooth loss, which, not surprisingly, is higher in smokers as well.
So can smokers have dental implants to replace any missing teeth?
Yes, smoking is not an absolute contraindication or bar to having dental implants, but smokers have a longer recovery time, and unfortunately, implant failures are higher among smokers than non-smokers.
What about people who smoke pipes or chew tobacco? What about that?
They also have an increased chance for gum disease, and tobacco use of any kind significantly increases the risk for oral cancer as well.
So what should smokers do to try to protect their oral health?
The best advice is to quit smoking. Also, it's very important to have careful attention to daily home care. It's also important to work on brushing and flossing, along with regular visits to the dentist and the periodontist as directed. At Kansas Perio, we often treat people with gum disease as a consequence of tobacco use.
Great information, as always, Dr. Wagle. Thanks, and have a great day.
You too, Ted. Thanks.
Thank you. That is Wednesdays with Wagle. It's sponsored by Kansas Perio and Dental Implants. When it's time to get services about your smile, go to kansasperio.com.